I found all the physicians that I met to be really exciting and happy and also feel gratified by what they were doing. So that was what pulled me to the practice. I really found that the physicians are super happy and just are rewarded by their experience. I like to listen to my patients. Sometimes it's really easy to get caught up in test results or lab studies and want to target in on something you think they have. But I like to listen to my patients and really hear from them what the problem is. Vein issues sometimes in some people, for whatever reason, aren't necessarily problematic. And so, really listening to my patients and putting their symptoms first, and then trying to apply what I know from the test results. That's how I approach patient care. Well, being a vascular surgeon, I have a number of skills that are tailored towards treating vein disease, but I also have some special skills that enable me to treat more proximal vein disease, so vein disease in the pelvis and those involving the inferior vena cava, as well as some of the branches, the vein branches off of that. That's a special skill set. I also was trained how to do some cosmetic procedures too. I see my role as somebody that's guiding patients and helping to make their life more comfortable and provide them with more quality in their activities and daily life. A physician, but one that wants to be goal oriented with the patient. That I will listen to them and take what their concerns are as well as what their symptoms are and try to come up with a treatment plan that's specific to them. I think that vein disease is really unique, and just like our face and our appearance, our veins are different from person to person. And for reasons that we don't necessarily understand, those differences translate into symptoms. So I'll approach each patient based on the symptoms that they have and the concerns that they have and develop a unique treatment plan. Sometimes it's one treatment that's needed, sometimes it's multiple, but I'll take that into consideration with what the patient's concerns might be. So very focused on the patient coming up with a unique treatment plan. Those are my goals, to help them meet their ultimate goal and get the quality of life back that they want. Providers should know that I want to take that patient unique approach and setting up these treatment plans. I also want providers to understand that I want to take the patient's overall health into consideration. So I'm not just going to be the doc in the box that takes care of vein problems, but I want to consider other things that might be contributing to their vein problems. Things like their arterial disease, maybe congestive heart failure, other sort of problems or anomalies associated with the lower extremities. So I'm going to consider other things outside of my scope of vein practice as a part of that differential diagnosis. I like to have fun, and this should be an environment that's low stress and fun for the patient. I want to get to know the patients. I had a good rapport with all my patients before, and half the time we would laugh and joke through probably 75% of their appointment. Just because we got to know each other pretty well. And I'd like to have that same sort of rapport with my patients. Just to keep it light and friendly and fun.